Hey, Bill. You are muted, Bill, so I can ask you to unmute. There we go. I can hear you. All the Bills.
Bill.
How's it going, fellas?
I mean, you know, this is pretty unsettling, obviously.
So he emailed me last night and said he's going to get clarification on what those rules mean. I don't think it means the announcement yesterday. You mean about the team sports thing?
Club team sports, yeah.
Yeah. So, I mean, I don't know if that applies to adults. Obviously, it applies to probably kids, but he's gonna clarify. Because what happens is the governor makes these statements, and then there's not really like an actual written anything. So then, again, we're kind of left with figuring out all the finer details on our own. So.
Did you see the news conference, Chris?
Like a little bit of it. Was there anything in there that he said that was more concise?
Well, the most troubling part was after he finished his thing, he kicked it over to his chief of staff, who said, no, we're not just talking about high school sports, we're talking about all youth sports activities, which is really troubling if it, you know, if they're going to extend it to all junior programs and things like that, it would be a nightmare. But he said there would be guidance coming within hours.
Yeah. Within hours means some point today. So, and it doesn't, and I love how he's so casual about it. It's like, you know, it doesn't go in effect till Monday. I'm like, oh, okay. So just, you know, let us wait and wonder, I guess. I don't know. Figure it out. It's hard to know what they mean. And if they, and they say it excludes colleges and pros, but it doesn't say if it excludes, you know, everything else. So as it is, we have enough issues with the adults to begin with. We'll have to see. I'm going to unmute you guys while, or ask you to unmute so you can all check in and say hello.
Hi, everybody. It's Karen. I watched yesterday. I agree. Very, very frustrating.
Yeah, I mean, it technically didn't say lessons. You want to?
No, but it didn't say kids either, in my opinion.
Right.
It's so vague, so frustrating. Anyway, I'm here. Hi.
We'll give everybody a minute or two to get on.
Hey, Chris Merrill, how you doing?
Is that Bobby Dean calling stealth?
You betcha.
How are you, Bobby?
You betcha. I'm good. How are you?
I'm doing all right. Hanging in there.
That's good.
Like everybody else, just hanging in and hanging on tight.
Waiting for the shooting drop. Waiting for the shooting drop.
Yeah.
So, Chris, looks like Rhode Island shut down. It's going to close down?
They're going to shut down for, what is it, 2 weeks, starting December 3rd or November 30th, right?
The Monday after Thanksgiving.
Yeah.
Yep.
Yeah. Except they're keeping the K through 6 kids in school.
Yeah.
Or K through 8 in school. So, I mean, again, if they think they can do it, that's fine. It's not really the younger kids. It's more the older kids.
Yeah.
So, we will see. All right, let's give it one more minute. We've got some pretty good turnout so far. Rostic, are you going to show us your new haircut, or are you just going to tell us you got a haircut? I think we should see it.
Don't I look sexy?
Let's see it. Where is it? I don't see
He's
it.
got a little side on that, yeah.
Oh, there it is. Oh, okay, yeah. Oh, nice, yeah. Oh, yeah.
Justin Bieber's in
Oh, yeah. We're gonna give him a big round of applause there. Big round of applause. Very exciting. Very exciting. All right. So a couple things as I keep pulling people into the meeting, that we are recording the meeting. So if people cannot make it, we can always show them later. And that would be a good thing probably. Then we'll have probably Jensa, who's the doc from Yale, coming on at around 11. I think between now and then, it would be a good idea to pick the brain of the senior USTA staff that we have on the call so we can get some guidance on, I guess, the hypotheticals of what would happen if we did actually continue to have any sort of adult or junior USTA play, although I think the consensus that we're probably all thinking is that it's unlikely. I don't think we should do anything until we know for sure, because I don't know. So once we figure that out, we can kind of go from there. Christy, you want to introduce yourself? You're new, and I think everybody's probably excited to meet you if they haven't already. And you can give us a rundown of what you feel our competitive position is right now, and then if people have some questions about it, they can ask. I'm alone now. I can take this back off. Bill, did you want to introduce yourself? Everybody kind of knows you. If your name is Bill, there's an 84% chance somebody knows you on the call.
No, thanks. I did notice that Matt Olson and Sean are here. Yep. And wondering if their ears are any closer to the ground on this stuff than us, representing the national governing body. So that's what I meant by that. So. Okay. Well,
Christy, you've unmuted, so why don't you start, and then we can kick to Matt and Sean if they have anything new for us.
Yeah, hi. Thanks for having me on. It's nice to see everybody and hopefully some new faces. For those of you that don't know me, I've been the tennis service representative for UST New England and Rhode Island and Southeastern Mass for the past 4 years, but I just have been working on training to take over the big shoes that Heather is leaving in Adult League. So I'm a section league coordinator right now, working on getting me all up to speed on what needs to happen officially in January. So yeah, I hope I can answer some questions. I think a lot of the answers are going to be, we don't know and hold off and wait, which is really unfortunate, but I will do my best to answer any of the questions that come up, and then make sure that whatever those happen to be, if I can't answer them, I will write them down and get them addressed as soon as possible.
Anybody want to type in a question on the chat or ask a quick question while we have that quiet moment? Going once?
Is someone not willing to wear a mask a reason to reschedule a match at this point?
That is something that we're taking on a case-by-case basis, and partially is because Massachusetts, Rhode Island, and in some ways Connecticut has the exemption, the medical exemption, and there's a lot of leeway between whether or not that medical exemption actually has to be proven or not. So what we're trying to do is anybody that has this medical exemption, we want them to communicate with the club before the match, with the other captain before the match, so that the lineups can be discussed. Not that we don't want you to get there and we don't want anybody to be surprised. So
sure.
That being said, if it does become a problem, we really do want you to talk with, is that Karen Fothrop that's asking?
That's
no, this is Beth Hall. I'm the USTA coordinator for Guilford Racket.
Oh, hi. Okay, sorry. I saw that number. I thought it was Karen's number. So what we'd really like at that point is for you to contact your local league coordinator and, before any matches get there, before anybody gets to the club, before it's, kind of a fire drill to make the decision about what's going on.
Yeah, we just have people saying we don't want to wear masks, so we want to reschedule. And honestly, I'm not putting in the time to reschedule because I don't see this really going away within the league season. Like if to me, it's a forfeit, but I don't want to, say that without it being backed up.
Well, and this is also in the discussion about what the Connecticut government actually is has said,
saying.
because
Yeah.
I know, Chris, as we've had all the clubs and all of the players sign a waiver that says that they will abide by whatever the government is saying. So that's why we're trying to, if we have individual players, 1 or 2 or 5 here or there, we're trying to talk to them before they get to a match.
But as far as a whole team then, Christy, that's a different ball of wax, because I think what we're seeing in some of our cases is an entire team, and clearly the entire team can't have a medical exemption. That would be a little bit coincidental, saying that, well, we're not doing masks at our club, so we don't want to come to your club and play the match because you're doing masks. And that again goes to the problem of not having everybody on the same page down here. And this may be a moot point on Monday, but it's still a thing that's happening this weekend, and that's where I think we need to have that clarity, because we want to. If this is in fact the last weekend between January now and January 19th, I would hate for people to not play a match because of a reason that's not really a reason.
If people are coming into your club and your club has a mask policy, then they need to respect the mask policy unless there is a medical exemption.
Okay,
What we're getting back is, well, come play at our club.
Or we refuse to come to your club to play because it's masks.
Then they need to at that point, the captain needs to contact the local league coordinator, and we need to talk to the captain, and we need to deal with it on a section level.
Okay.
Okay, so I have contacted Connie, so my assumption is that she would then contact you?
Yes, that's correct.
Okay.
Okay. Thank
Great.
you.
Anyone else have any questions for Christy? Anything else? Matt Olson, do you want to grab the floor and give us an update on things as you see them?
Hey, Chris. Another great turnout. Thanks for including us. I wish all of our states throughout the country would collaborate and communicate like the Connecticut clubs do. So thank you so much for including us. I think what you're seeing now and you're going to see moving forward is that Shauna is going to be really continuing to communicate the changes that are happening sometimes day by day in the tournament space with tournament directors, clubs, parents, and players. And then Christy, in her role, will be working with the local league coordinators to make sure that they're addressing issues and answering questions just like she is today. So I think that'll be probably the best approach to take, continuing to move forward with what could be a pretty unsettling winter. I do want to sincerely apologize for the confusing email that went out from USTA New England to all the players and clubs this week about the mask indoors and outdoors. Hopefully the email that we sent out yesterday helped clarify that. We did have a few people concerned that we'd put it was mandated for outdoors. So apologize for that mistake on our part. But, and then, the only thing that I have really heard this week that is promising is that the Brian Hayline, who's the chief medical officer for the NCAA, is on the USTA board. He's the new executive vice president, and he's also a member of the medical advisory team. They're really, really encouraged about not only the news about the 2 vaccines that are, coming out with like almost 95% effective, but really encouraged by the news that Johnson & Johnson is in a position to produce 1 billion doses of those vaccines. So they're very encouraged about what we're going to look like as a country, as a world with the pandemic going into summer. But recognize, as we all know, that the next 2 or 3 months are going to be really dark and terrible. So, I appreciate that everybody's doing their best to just do the right thing and wear masks. So, Thanks, Chris.
Thanks, Matt. Shauna, did you have anything you wanted to add?
No, I don't think that I do at the moment. The Junior Tournaments Committee will be meeting today to discuss all of the changes that have transpired or will potentially transpire in the next 24 hours and some of the guidance that's come down in the last 24 hours from Connecticut, but also Rhode Island and New Hampshire. So we'll be meeting today. If I have any updates, I will be sure to forward those along to you before we forward them along to any players. I know the mask situation is tricky. I know in Massachusetts, they don't have to wear masks for singles, but they do for doubles. And that was tricky for a little bit of time because some were saying yes and some were saying you didn't have to. But all are on board and everybody is wearing a mask indoors, regardless, except for when it comes to singles. So I don't know. And Chris, do we know when there will be a decision made about, I mean, I know that it's come out that Connecticut is moving forward with postponing sports until January, but then I heard that it was like winter sports. Does that include tennis in there? Is it all sports? Do we know yet?
He said he's going to try to clarify it all today.
Okay.
So I think it is all sport. I don't think there would be a reason to single out sports, you know, and this is what they've been doing all along is whatever is going to happen to everybody. So
Right.
unless it's one of these, you know, outdoor, you know, long distance running where you're, you know, not going to affect anybody, they're really blanketing sports.
Yeah.
Where I think we now as a group need to start looking once we get past whatever they're going to say. And I'm hoping that it's not going to affect anything that happens inside your building. I mean, if it's one thing if I bring a team to Bill Donahue and he brings a team to me and they say you can't do it anymore, but we should be allowed to still do lessons and groups and programs and practices and not be affected by that. But I have no idea. That would be bad if we had that little piece gone. It would be catastrophic if they said, no, you can't do a junior program at all.
Right.
I think for everybody on the call, there's no disagreement about that. It's either going to be a little bit of a pinch or they're going to stab us right in the gut. But where I think we also want to start focusing now, our efforts is in the event that this starts to get, you know, there's a way you can do this that's a little bit more surgical and there's a way you can do it that's a big sweeping change. I would still like to see us pulled away from gyms, where I think that the state already has the evidence that there is a spread in the gyms. I don't think you could say the same thing about a tennis club.
Right.
Where I've gotten concerned, and everybody on this call knows this, where I've gotten concerned is that every club that's not using masks the way they're supposed to makes the odds of that spread not happening in a tennis club worse now. Because we are not in September or August or even early October where there were few cases of COVID. We are in the middle of, it's everywhere. Almost every town in the state is a red town. So there's no safe spot where you can go, well, you know, up here in this place, we don't really have a lot of it. Every town is red. Every town has a problem. And the odds of you now walking into the room where somebody has COVID are much higher than they were a while ago. So, you know, you have to think about how we are in a position to do the right thing and keep ourselves apart from gyms, but we all have to do the right thing because it won't be a matter of tennis is screwing up on a global scale. It'll be, we've had outbreaks at one or two of these clubs and we're going to shut you all down, which is unfair. It's unfair to the people who are doing a good job and are doing it right, but it is what it is. And the state is not going to change and say, you know, that gym has to close, but these gyms can stay open. They're just going to shut things down as they see fit. And that's where we are. Just a quick question while we're on the subject. And, you know, you guys can just put it in the chat so you don't have to unmute. If you can't chat, then you can speak. But is anybody not doing the policy of masks that the state has required? And I am using the word required. Where doubles and group lessons are requiring masks and singles and one-on-one lessons are just recommended. Is anybody not doing that? Anyone? Bueller.
That was going to be my question, Chris, because it says I think there's like two different pieces to the puzzle. It says it is required, and then below it says making sure that the town that you are in or the players that are coming from high or red towns need to ensure that they are requiring masks. Is that correct?
It is, but it
Based
isn't.
on your alert level?
So very quickly, and without retreading what we've already talked about as a group for the last couple weeks now, the Department of Public Health issues guidelines for the general public. The Department of Economic Community Development enforces those laws for businesses. And the way it works is, for example, if you looked at the team interstate competitions, and Christy and I were going over this with like a fine-tooth comb yesterday, it's not recommended. And then the state that runs the business says, if it's not recommended, you can't do it. So that's not a gray area. Then when you look at the other things where it says this, this, and this about, masks and athletes, it's the same thing. The Department of Economic Community Development says you must follow those rules. And then you look at the other thing and it says recommended. Well, I'm just going to play doubles with friends and the Department of Health says this is a recommendation. I can do what I want. But if the club as a business is told you have to do these things, you have to do those things. We also got clarification from the state itself. So there's not really a gray area with it. It's just enforcement, for one, and the ability to want to do it. So, all right, the moment that everybody's been waiting for has arrived. We actually have our very, very special guest, Jensa Morris. She's in her scrubs. She's in her office, I'm guessing, at the hospital, and taking a nice break. And Jensa, thank you so much for taking time away from your day, which I know is very busy. I just want to remind you, these are here for you whenever you want them. They're not pot brownies. They're just regular brownies. Take it easy, Bill Donahue. I know what you were thinking. You've never been on a call before. All the jokes are for Bill Donahue, just in case you were wondering. They're all for Bill Donahue. Maybe Rostic a little bit. Jensa, how are you?
I'm a little stressed, but I'm good.
Good.
So,
good.
Chris, can you let me share screen? Are you the host?
Let me see if I can do that for you. So right now, Jensa, what I would think would be great is if you could give us a little background on what it is you do.
Yep.
And
all right. Well, while you're fiddling with that, I will tell you. So I'm an internist. That means I'm a general internal medicine practitioner here at Yale New Haven Hospital. I'm a hospitalist, and since March, all I've been doing exclusively is taking care of COVID patients. So we started mid-March, and the work that I've been doing has been COVID care exclusively, nothing else. I've become now essentially the clinical expert here at Yale New Haven on the care of COVID patients, lecturing on the subject. This has become my area of expertise. Not really something that I had hoped to devote my career to, but here we are. So Chris asked me to come on because there are a few points that I wanted to help make just about how you can protect your staff and keep your business open, because we all love to play tennis. I mean, do you see my hat here? It's really cute. We all love to play tennis, so I want you to keep your business open, and I want you to be able to do so safely. All right, let's see if I can share screen. No, Chris, come on. You're still not letting me share screen. Seriously, Chris?
I don't know that I'm the one stopping you from doing that. And I'm trying to find a thing that says share screen. It says allow to multi-pin and all this other stuff, but it doesn't say anything about you sharing screens or not. So can you try to do it and see if it lets you?
Host has disabled participant screen sharing.
Really? What a jerk.
Seriously, Chris?
I know. I'm not a good host. We all know this.
You can make her a co-host, Chris.
Good. Thank you. Someone knows what they're doing.
Yeah, you can make her a co-host.
There you go. You are a host. There you go. You are in.
All right, let's try this. All right, here we go. Look at this. Microsoft PowerPoint. Here we go. I am going to share with you. All right, good. You guys can see my Chris, give me the thumbs up. Can you see it?
Yep,
good.
you're good.
All right. All right. So let me just get, okay. So I just want to go over some of the Connecticut state data where we are right now with COVID. I want to share with you our hospital projections of where we're going. We've got some pretty smart people who've been making projections. And then I want to talk about the risk to your pro staff, and then about just keeping your programs going and keeping the staffing adequate to keep your programs going. What happens when somebody gets exposed on your staff and what the guidelines are? And I really want you to be able to keep your clubs open. So I'll give you some guidance there as well. So this is the Connecticut daily COVID-19 positive rate. So in blue, we're starting in April, and we're going all the way to today. These are new cases detected every single day. And you can see those really great months we had where there were very few cases in Connecticut. So it was a great summer and fall, wasn't it? And then you can also see the cases rising. The black is the case rate. So that's the number of positive tests over the number of tests done. It's a little wacky back in April because we had no testing. So you really can't even look at that because we really weren't detecting all the cases that were out there. But since June, we've had really reliable, very abundant testing. So if we kind of look since June, yeah, the case rate's been really low. There are very few cases. And so this is real. We're at a 6% positivity. 6% of the tests are positive. It is rampant in our communities and it continues to go up. So I just want to make that point first. And then a lot of people say, well, it's not so much the cases, it's really like who's getting sick, right? I mean, if we're just detecting a lot of asymptomatic people or just people who are really just have the sniffles, we don't really care, right? So let's look at who's getting sick. These are the number of patients who are actually hospitalized with COVID in the state of Connecticut. So we peaked at 1,972 patients on April 21st, and we're headed straight north. Yesterday we had, 848 patients admitted within the state, and today, unfortunately, we broke 200 just here at Yale New Haven in New Haven, like not the whole system, but at Yale New Haven Hospital, we just broke 200 patients today hospitalized for COVID. So this is not going well, hence my stress. All right. Now, this is interesting, and I just want to show this because it shows that not only is this not going well, but it's going rapidly in the wrong direction. So on October 11th, what was that? Like, I don't know, last week? It was not that long ago. October 11th, our very smart projecting people said, okay, so here are the inpatient cases at Yale New Haven peaking in April, declining all the way through till June, a nice summer. And this is to where we were on the 11th of November. This grayed out area is their projection of where we're going to be through January inpatient cases. So on 11/11, they were like, oh, look, we're going to kind of level out. And yeah, it's high, but it's going to level out. So we're all kind of feeling okay. On 11/18, what was that, 2 days ago? We got new projections. These are our new in-hospital case projections. I'm showing you this to emphasize this is no joke. Our new projections take us going straight north through till January with error bars that we could potentially exceed our April peak in January. So, but remember in April, we were on total lockdown. And so we didn't have to talk about should we be playing tennis with masks or not. It wasn't even a conversation because we were not playing tennis. In January, we're going to look a lot like April. And so I suspect by January, you'll look back on this conversation and say, oh my gosh, I can't even believe we were having this conversation. It was, obviously we need to wear masks, but let's have the conversation. So here's what happens in your club when your pro gets exposed. So here's an average clinic. Do you like my little diagram here? We got 4 people on the court. I don't play doubles, but this looks approximately like how people play doubles. And you've got your pro, and this person calls the club the next day and says, oh my gosh, you're not even gonna believe this. I started to feel sick and I got COVID tested. And you look back on your court sheets and you find out that yes, that pro was on the court with this person within 48 hours of their onset of symptoms. And so this is considered a close contact exposure. So what do? Your pro cannot come to work. Your pro needs to quarantine from all contacts, including household members, completely quarantine. If the pro develops symptoms, they should get COVID tested, obviously. If they don't develop symptoms, regardless of whether they have a negative test, if they do not develop symptoms, they require 14-day quarantine. Like, that's not negotiable. So you lose your pro for 2 weeks based on that on-court exposure. If your pro develops symptoms, and I mean that as in if your pro develops symptoms after an exposure when they're quarantining, or if they just develop symptoms because they've got the sniffles, whatever, they develop symptoms, obviously they cannot come to work. As soon as they have symptoms, they need to get COVID tested. They need to quarantine from all contacts, including their household members. If their test is positive, they need to be quarantined for 10 days from symptom onset. So you've lost your pro for 10 days if they develop symptoms and have a positive test. Here's the kicker though. Anyone they were in contact with for 48 hours prior to the onset of symptoms requires 14-day quarantine. So presumably they were at work those 48 hours before they developed symptoms, and you just lost all your staff members who were potentially in contact with that pro within 6 feet for more than 15 minutes. So any exposure at your club, either from a client, presumably, or from a staff member, risks a 14-day quarantine of your pro staff member. If the pro then tests positive, you're probably losing them for longer because of illness, and you will almost certainly lose additional staff members to quarantine because they will almost certainly have interacted in the 48 hours prior to their positive test. Now, I know everyone wants to know, why can't I just send them, instead of quarantine, why can't we just test? That's what the tests are for. Let's just do the test. They're negative, they can come back to work. We're done, right? So this is the hardest thing to explain and the hardest thing for everyone to really understand, because it just doesn't seem right that we should have a test and that we can't use it, but it's true. I'm exposed, or your pro, let's say, is exposed to the virus. There's an incubation period. The virus has to do its thing for up to 14 days before you develop symptoms. Then in the 48 hours prior to developing symptoms, that person is shedding virus like mad and continues to shed virus for 10 days after. All right, so let's say we know they were exposed to the virus, and because you got a call from the client who says, listen, I'm positive, I was on the court with so-and-so, and you send them for a test. Here's the problem. The probability that that test is positive is essentially zilch, zero. You will not get a positive test right after exposure. The probability the test is positive essentially peaks right at the time that the person is developing symptoms. So they're, even in the day prior to the onset of symptoms, they only have a 50% chance of having a positive test. So you're going to very likely have, I mean, it's going to be negative. It is almost certainly going to be negative, which is why we say you got to quarantine, because that negative test does not help you. So that's the hardest thing to kind of get that message out. But this is easy. This is an easy problem to solve. Wearing masks, both people wearing masks plus 6 foot distance reduces COVID transmission to essentially zero. Your pro is no longer a close contact when you get the phone call that so-and-so on your court tested positive. You say, that's fine, everyone was wearing masks, carry on. Now, if a 6 foot distance cannot always be attained, for various reasons, I am recommending that your pros use the KN95 masks that are available on Amazon, because then you're absolutely certain that your pro is not going to be lost to quarantine. And then potentially losing other staff to quarantine, you are certain you had your KN95 on, that's PPE, you're done. I know everyone's worried about people saying, I can't play tennis with a mask on, and I get it. It's not intuitive, but this has been studied. There's no carbon dioxide retention. Carbon dioxide is a tiny little molecule. It diffuses right through the cloth of the mask. Through the mask. You can breathe. It turns out there's no impairment in oxygenation. I played a match last weekend. We all played with masks. It was okay. So these are the masks that we're wearing in the hospital, just to let you know that, maybe there's something that we know. These are the various masks that we're wearing. So please let me answer all your questions. This is what I live and breathe. This is what I do every day.
Thanks, Jensa. If you want to unshare, and then we could do.
Okay, unshare.
Ready?
All right, let me figure out how to unshare. All right. Stop share. Got it. Done.
Does anybody have any questions? There's no bad questions.
Come on, you've got questions.
There's questions.
I have a question. So the masks are for breathing. Is there a possibility that it goes through the skin?
Wait, I lost you there for a second.
Is there a possibility that it goes through your skin as well?
No.
Okay.
So one of the things that people ask is about contact, and we have, at this point, the medical community does not think that contact is a significant means of spread. The literature shows that it's essentially droplet and aerosol, so it's breathing. It's all about breathing. And no, there's nothing going through your sweat.
What about gaiters? We have a lot of pros that are saying that they're okay with gaiters, and I know there's some discrepancy about the effectiveness. Would they just write that out?
Yeah, you're absolutely right. There is a hierarchy in masks, with the obviously N95s being the best, and then the surgical paper masks after that, then the cloth masks, then the gaiters, then the handkerchiefs, or whatever people use after that. It's a hierarchy, but essentially the CDC says that if you're within 6 feet for greater than 15 minutes with anything less than PPE, you're considered a close contact. So gaiters, it's really not going to protect your pro if they're within 6 feet. If they're not within 6 feet and the other person is not within 6 feet ever at all, then I mean, you can, but I would think if you wanted to protect your pro, you would put them in a N95.
Yeah, I think I'll order them.
PPE is only K9, the N95. That's it.
So, so the N95s that we're wearing at work, you can't buy on Amazon, but the KN95s are the ones that are available on Amazon. Yeah, and yeah, those are available, and they are adequate.
Is a surgical mask considered PPE, like the paper?
No.
Okay.
The surgical masks are considered better than cloth, but not adequate if you're within 6 feet.
Okay.
Anyone else? Any questions? No questions?
Yeah, 6 plus 6
I have one.
feet. Okay.
I have one. Can you hear me?
Go ahead, Karen.
Yeah.
Oh, okay. So my question is related to, let's say you do have a singles court and you do allow them to play without masks. They're greater than, the required distance apart while they're playing, but then, they put their masks on, they leave the court, somebody else enters the court.
Yeah.
Does that,
Yeah.
let's say they have it, is they in the air?
Yeah.
I mean, what happens to the next people?
Yeah, no, it's a great question. That is a great question. So droplets remain suspended in the air. The duration of time that a droplet remains suspended in the air varies depending on your ventilation. So that's why outside is better than inside, because outside there's always some kind of air circulation and the droplets aren't suspended for as long. But absolutely, if you walk onto a singles court right after onto any court right after someone without a mask and you didn't have a mask on, you are at risk. No question about it. And that's also part of the reason why doubles without masks is so dangerous, because even though you could potentially always keep your 6 foot distance, you are continually running into the other person's space. They have just exhaled those droplets. Those droplets are suspended. You're inhaling them. That's it.
Jensa, it's Sarah.
Hi, Sarah.
I just wanted to know if you could clarify, and hello everybody else. I'm sorry, I have this big screen but no camera, so I can't see you all, or I can see you but you can't see me. you have clarified for me, and I think it would be helpful to clarify for others listening, that 15 minutes close contact is over what period of time? Because if you say to me, hey, you're playing doubles 15 minutes within 6 feet, I'll say, oh, but I'm just quick, 30 seconds talking to my partner and we walk away, and then another minute talking about strategy and another minute learning the next drill or whatever. So can you talk a little bit about that, please?
Yeah. So the CDC did a really interesting study that showed that it is clearly a cumulative 15 minutes within 24 hours, and that can be 30 seconds plus 30 seconds plus 2 minutes. And so over the course of a 2-hour match or an hour and a half clinic, if you're intermittently within 6 feet, you are clearly at risk. And as I said, those droplets remain suspended. So even if you're not within 6 feet, but you move into their space and they move into someone else's space, you are at risk. Sarah, does that answer your question?
Yes.
She got distracted.
I didn't get distracted. I muted, so you wouldn't hear me back there.
Okay.
Yes, that did answer. Thank you.
And so I have a quick question. As you were talking about keeping the staff safe and everything else, if you had that same clinic where you had, the pro and then the 4 people, and then the one woman on the court said, oh, I think I didn't have this, and no one was wearing masks, what happens to all the other people on the clinic?
Yeah. So they're all close contacts. Every single one of them is quarantined for 14 days. You would not be popular. That is a very quick way to not make friends. Everyone is quarantined.
Okay, thank you. We have a question in the chat, Jensa, from Len Samar. Does CDC still say that exercising with a mask is dangerous?
So the CDC has actually never said that exercising with a mask is dangerous. What they do say is if you are uncomfortable and feel that you cannot breathe, then you must do something differently. But they don't say it's okay to exercise without the mask. They just say change your activity, perhaps exercise alone so you can not wear a mask. But they don't say it's okay to not wear a mask when exercising. Does that make sense?
Got it.
Okay.
Great. Anyone else have anything for Jensa?
Chris, are you recording this? This is Andre.
I am recording this.
I forgot to record it. Can you get it to me?
Yep, I got you. Okay. Any reason why people shouldn't be touching the same tennis balls during clinics, matches, etc.?
Yeah, great question. And of course the answer is we have no idea technically. Nobody has studied it, so I can't tell you about the one study that showed this or that, but we really do not think that contact is a significant means of transmission of COVID at this point. So I would certainly say that in my own practice, I am super cautious, but I am now touching the tennis balls.
Thanks. Anyone else? Bill Donahue.
Yeah, I got a question regarding junior players. If you have a player in your program that has a brother or sister that is self-isolating because of a contact, how do you feel about the brother or sister coming into the program?
So that's a great question, and that comes up often. So here's the deal. Anyone who is a close contact, so that's usually a household member of someone with COVID, absolutely needs to isolate. If you are a close contact of a close contact, you do not need to isolate. So let's say the kid gets a call from the Department of Health that he was exposed at school and that he needs to quarantine. He goes home and he quarantines that kid who was exposed at school. Now his siblings do not need to quarantine because they were not exposed at school. And the siblings can all show up for tennis and lacrosse and school and everything else. Make sense?
What if the sibling shows up with the other sibling in the back seat of the car?
No.
Dropped off for tennis.
Are people crazy?
Yeah, I think so.
Yeah. So obviously, if you see that happening and then clearly they are not quarantined And that's just a no-go. That's an absolute no. They are not following the proper quarantine guidelines.
It is hard to police it, of course, when we hear someone who says that child is supposed to be quarantined right now because we know, and go and ask them.
Yeah.
We say, hey, you know, should you be quarantining right now? But it's really hard to police.
Yeah. Yeah. So you can't. You absolutely can't police it, which is why if you just have a standard, everyone's wearing masks, then you kind of take the
Right.
policing out of it.
Yeah.
And you know, your primary job is to protect your pros. I mean, first and foremost, of course you want to protect your clients, but protect your pros with KN95s.
That's the best I've heard.
Yeah.
Okay. Anyone else?
Jenza, Peter Arbanovsky. I have a question. Is the temperature test significant?
Oh, no. So absolutely not, because the time at which you develop a fever is the onset of symptoms. So you've been shedding already for 2 days by the time you develop that fever. So this is something that, you know, we check people's temperatures if they walk into the hospital for, if there's any reason to come into the hospital and they're not a staff member. But we do that for optics. I mean, it's all about, you know, we do a nice little screening questionnaire, we check your temperature, but truly, if you have a fever, it's too late. You've been shedding for 2 days. Yes, we don't want you in our facility, but we didn't want you in our facility 2 days ago either.
Is it still, though, Jensen, not a bad thing to do in case people who, you know, aren't here for the 2 days then show up with the fever?
Sure. I think what it does is it screens out some small portion of people who did not realize they were symptomatic. So you are going to screen some people off, but it is by no means should be relied upon as a screening tool. Does that make sense? That you're going to miss a lot of people who are shedding virus.
Yeah.
But you might
Hi,
catch
this
you might catch a few.
We have the thermometers on the wall, and we put them in at expense and whatever. And I'd already been talking to Jensa, but I do think it gives people a sense of comfort, and it really gets back to the optics of it. But that is not the tell-all. It's certainly not going to catch everything, but it makes people feel a little bit reassured. I think the masks are the way to go.
Great. Any other questions? Anybody else?
Extremely helpful. Thank you so much.
Oh, good. And, you know, Chris will put you in touch with me if you have any questions that are specific to your club. I mean, this is somehow I've had to become an expert in ventilation and all sorts of other things as this has come, you know, as this has evolved.
Appreciate it, Jensen.
Okay.
All right, Jensen, go save some lives. Thank you very much.
I will.
Appreciate
Thanks.
it.
Thank you, Jen.
Thanks.
All right, so some good information there, I guess. Good stuff. I guess right now the big thing, besides, you know, any discussions about masks that we are still having that I don't know why we're still having, would just be to figure out what the next steps are based on the state's proclamation or whatever it was yesterday. I don't know, obviously, because the state does things on their own timeline. I don't know when they're going to come up with this new stuff, but we'll all have to keep an eye on it. If anybody sees it first, because a lot of us are on and off the court throughout the day, we can touch base and try to figure out, you know, what that means for us. And if there's and look, there's a solid chance that whatever they're going to say is still going to be unclear. So, you know, it's always the case that we don't know what we're going to get, because the state will give general sports guidelines, and then things that are specific to a sport will be different. Any other quick questions? I know we have a couple of clubs that haven't been on in a while, or at all for that matter. I know Peter, you're from Old Greenwich Tennis Club, correct? Peter Orbanowski, right? He's there somewhere.
Yeah, I'm here. Yes, Old Greenwich Tennis Academy.
Great, Peter. So Peter, because you haven't been on for the last few weeks or whatever, what is Old Greenwich doing with their masks in terms of you know, what the state's been telling us to do?
Following the state guidelines.
Okay. All right, great.
Have masks.
Yep, and then
Hard to police the adult doubles, to tell you the truth. We're recommending them.
Yeah, I know the layout of the club, so I know you guys don't actually have the visuals that probably some of the other clubs do. Delizzo's iPhone, is that Dave from Westport? I don't know who that is.
Yes, that is.
Sure. What's Westport doing then, Dave?
Well, we're doing mandatory masking on the, in the building and on the court. So everybody is supposed to wear a mask, whether you're playing singles and doubles on the pro.
Okay.
So we're just all gung ho with.
Good.
That's what we're doing.
Excellent. And then I think Deb Tristan, you're Mystic, correct?
That's correct. Mystic
Yep. So what's Mystic doing right now?
We are doing all masks. Everyone wears a mask. And, you know, as someone just said, you know, we policing it seems to be, you know, the hardest part, making sure everybody keeps it on during their play.
Yeah. Yeah, that's always been the thing. Or not around their neck.
Exactly.
Or wearing a mask. So, and I think, Kendra, I know you haven't been on in a while, but I know I heard through the grapevine that Weston was doing all masks pretty much for the last 2 weeks.
We've been doing masks for anytime there's more than 2 people on a court. So privates and singles, you don't need it, but everything else you do.
Yeah. Okay. Great. Anything else? Any questions? Anything else we want to go over? Or anything I'm probably out of jokes to make Bill Donahue laugh at this point, so I don't have much left. But I think we got some good info, if nothing else, right? So I did record this. I will share the link or share the file or whatever I have to do to get you guys to review it if you want to, and to the other clubs. And let's try to maybe set something up for next week once we know how all the pieces are going to fall with the state's new guidelines. I heard recently that some indoor clubs are still not requiring masks for doubles. Did the governor's confirmation go out to the broadest distribution list? Wondering if most clubs saw it. Matt, I did send that out to everybody. Matt, you are privy to the calamity of last weekend when everybody knew before me that Dave Lehman had responded because I didn't get his email. And Bill was good enough to call me on that. And then the same thing happened last night. I actually copied one of my personal emails when I emailed him. I did not get the response, but the other email did. I don't know what I did.
I don't think he likes you, Chris.
No, he's responding.
He got out there pretty quickly.
He doesn't look. There's no doubt he doesn't like me. It's just he is responding. I just didn't get them. Bill pointed it out. He said you're the first recipient in the chain, but you're not. You didn't get it. So you know, I've heard that too, Matt. Again, this is where it comes back to any kind of enforcement that we have, and we don't have much. There was a rumor going around. I can't remember who told me this, that some guy was calling all the Fairfield County clubs saying he was with the state. Did anybody get a call like that down in Fairfield County? No? Maybe you guys were doing it right so he didn't call you. But one of the other clubs that was iffy on the masks told me that they were getting that phone call. So, you know, I don't, you know, as we talked about before, there's nothing we can really do except the more people that do it puts pressure on the people who aren't. And even there, it won't make that big of a difference. And I know down in Fairfield County, there seems to be the biggest split, I think. Although here, I know we're not 100% either on the shoreline. I think Hartford's probably the closest. Bill Donahue and Bobby Dean, you're not muted, so you can talk. Do you know of anybody up your way who's not masking?
I don't think so. Just not singles, but mostly doubles and lessons more than 2. I think pretty much everything. Magic is, I heard.
Yeah, he called this morning. He couldn't make the call. Do you know what about Big Sky? I don't think they've ever contacted anybody here. Bill Donahue was saying yes. Is that accurate?
They're either in the process of going there or they have. I talked to Brett Smith there yesterday, and I think they are.
Good.
Now. Yes.
Good. How about Bob out in Pine Woods? Anybody know what he's doing? Is he?
Not sure.
Not sure. Nobody knows. Yeah, Matt, you're just as close as the other guys are because he's kind of in his own little world out there. So he is on the email list. He gets the emails every time you guys do. So
yeah, Bob has instituted it.
Bob has instituted Jim. Okay.
Yes.
All right. Great. And then what are the holdouts down in Fairfield County then? Is it just Solaris and the Goki clubs. Is that correct? Chris, you're saying yes?
That's what I've heard recently. I don't know if that's true, but I've heard that from members of mine that play here that told me down at Kings Highway and Solaris it's still optional.
Okay. Peter Urbanowski, what about the other Greenwich clubs? What about Greenwich Tennis and Innis Arden? Are they doing masks? You're the closest there, so you would maybe know before us. I'm sorry, Peter, what?
I'm assuming they are, but I really don't know because I haven't been in the clubs to check.
Okay. Okay. All right. Len, you're off mute. Did you want the floor?
Oh, no, sorry, just.
You can have the ceiling too if you want. I can give you both the ceiling and the floor.
Creature of habit. I'm just wondering why we can't get the rest of, after hearing this, please send it to the clubs that aren't doing it.
I agree with Len on that. Yeah. Everybody should be doing it by now. I mean, my God.
Okay. Yeah, well, that's the trick, is that the people who don't participate are the ones who won't do it. And some of the guys who do chime in every now and then are still gonna, not do it. But I think we're making progress. I think we're doing the right thing. I think the more we do the right thing, the more we have a chance of maybe doing that separation from gyms. So if something does happen when the governor gets patient.
Chris, knowing that one case that happens at your club, not just one pro, but all pros are gone for 14 days, should be enough for anybody to say, what the heck, come on.
Agreed.
Yeah.
Agreed.
Yeah. Well, especially if they're, every club is a little bit different, but if you're hanging out in the back room with a bunch of the pros for 15 minutes and talking and all that stuff and you're all interacting, then yeah, that's going to be bad news.
That's another thing I just discovered too. I'm going to put a rule in immediately. The pro lounge is now off limits to one person at a time. So.
Yeah. Yeah. We've been trying to do that too. Be limited.
It's hard.
He had nothing to do.
It's hard to enforce things after spending years of trying to create camaraderie and people congregating and becoming friends, but it seems like a no-brainer if we want to stay open and keep people's livelihoods and their families safe, and the members who are trying to support us and keep their families safe. I had one woman, I said to her, I'm sorry, I know playing with a mask is inconvenient. And she said, Sarah, you know what's really inconvenient? The pandemic. The mask, no big deal. We can do that. And I really appreciated that. And the people who aren't supportive, I have to say to them, I stand by my decision. I have to protect my team. And if they can't get with that, then I hope they'll be back when things are healthy, but I don't really want them hanging around.
I agree. Yep, Matt?
Yeah, so I guess just one situation. It's only happened once, but I had a club from another location for a USTA match call our club asking about a medical exceptions for playing at the club without a mask for a doubles match. I basically said that it was not okay. I don't know if anybody else has taken that stance. I just don't want to set a precedent that it's okay to play in the club. I don't think it's fair. So I don't know if anybody else has taken that stance or if I'm maybe out of line with that.
I haven't taken that stance, but I probably will.
Yeah, I think the medical exemption thing gets really dicey. I had a guy who's a 4'5", 40-something-year-old guy do point play last Friday, and he has asthma. He's fine. So, if they really, really have a hard time breathing or whatever, they shouldn't. First of all, if they need a medical exemption to play tennis in a mask and they're playing USTA, there's a little bit of a disconnect right there. That's a little bit of a shocker. It would be one thing if you had a senior citizen who played at 7:30 in the morning who said, look, I really have a hard time breathing, but you're selling me on a person who needs a medical exemption who plays competitive USTA?
Exactly.
I don't know. Something's not right.
With the USTA, I would absolutely enforce it for a USTA match, Matt. What we did have is a member who was talking about her clinics and needing a medical exemption, and she got it. And I went to Jensa and I said, what do I do about this? And she said, if she needs a medical exemption to play without a mask, she's now not protecting herself either. So she probably shouldn't come to the club. And guess what? She found a mask she can play in.
Yep, she did. So, all right. Sounds great, guys. Yes, Rostic.
Quick question. So is everyone assuming right now that what Lamont announced yesterday really just applies to team sports, that it shouldn't apply to us, at least as of the moment? My interpretation, which is just my interpretation and nothing else, is that
we're done playing junior team tennis and adult USTA. I don't think it affects anything else. I could be wrong in either direction. Does anybody else?
You don't think it affects our junior programs? What about our junior programs?
I don't. It didn't say lessons and clinics and everything else. It said team. It's a team competition.
Chris, they've never been. You and I went around with this the other day. They're never specific, and they never will be.
That's true. Well, that's why he said he was going to try to clear it up today. And by clear it up, he means maybe clear it up.
So adult, likely the USTA adult leagues are going to be stopped. That's your opinion, Chris. Adult USTA.
I think if they're going to do teams, then they're not. Then they're not going to do teams. It didn't say. I mean, I know the most of this involves kids, but you know there is still a part of this that is adults as well. And it didn't say the exemption was for pro sports and for college sports. It didn't say anything else. So I'm just going to go on what I've got. And hang on one sec.
Hey, Chris, I just got this from my desk manager, Camille, and she said all USTA ends Monday.
But is she guessing that?
I don't know where she got it. I don't know if she got it from Connie. I don't know where she got it from. Once I get off the call, I'm going to find out.
Well, Susanna's on the call still now. Ask her. Susanna, did you hear that already or no?
Can you guys hear me?
Yep.
Yes.
Okay. My read of it is exactly what yours is, Chris. That, I mean, this is from the Hartford Courant, and I saw the same thing. I've been checking the state website, and there hasn't been anything on there since last night, I didn't think. But my read of it is all team sports, so junior tennis, league tennis. So it's not just youth high school. So all competitive team tennis should be suspended from November 23rd to January 19th, but that does not affect club operations for your normal clinics, lessons, and so on.
Yeah. And can you guys see this that I'm sharing the screen right now? It says that Lamont announced that all club and other team sports must pause all activities until January 19th. So in theory, nothing you do with a team unless it's I think they're trying to avoid having 15 kids on a basketball court at one shot or something like that. Now, I would caution that if we're going to do anything in the clubs that's still going to be clinics and everything, that you would rename whatever you're doing, not a team, because what would happen is if somebody and this is always the fear, is that somebody whose parents, have kids who play lacrosse. Well, my son went to a team practice at his club the other day playing tennis. Why can't we have lacrosse? And then that gets sticky. But if you said my kid went to a lesson, I think that's different. And that's an individual sport still to a degree. Dave, do you have a question? Or are we answering it?
I have a question. David with Westport.
Yep.
So are you saying, I don't know if Rustic is on this call, from what you're saying, there will be no team tennis until after mid-January?
That's my opinion and my guess. That is Susanna's opinion and her guess. It is not anything that I would say I would hang my hat on because I just don't know.
Do we have a USTA official on the call right now?
Yeah, Susanna's the one who just spoke. She's the coordinator for Southern Connecticut. So
again, my opinion is not in any official USTA capacity. This just came out yesterday, and we have a call this afternoon to discuss it within the larger USTA Connecticut group. But that is my read. And again, I was listening to Lamont's call yesterday. I listened to the whole thing. The whole thing I think goes behind it is the whole idea of a cohort. When you're in your club, the same people are coming in. There's some sort of a loose and official version of a cohort where the same people are coming to the same area. Once you start mixing teams, where different teams from different towns are coming together, that's when this whole thing is amplified.
Right, because we're trying to figure out, we're registering kids right now. We have to communicate. So the sooner you get that information, just shoot it over to us, and maybe we can pause what we're doing.
And tell me again, David, which club are you from?
Westport.
Westport Indoor Tennis?
Yes.
Okay, thank you.
David, I could tell you from a JTT perspective, I spoke with John this morning, and we're just not going to make a decision until the state explicitly tells us what we have to do. just me personally, I just think everything that they talked about is aimed at team sports, and even JTT, I don't view it as it's still individuals playing singles and doubles. I mean, that's just completely my opinion. So I would hope it doesn't apply to us, but.
Right, but I think, Rostic, it's still a matter of you're bringing 6 to 7 kids from Bloomfield over to East Hartford, and I think they're trying to prevent that mixing. That's what I think they're really trying to avoid. So the question really is less about
tournament.
What's that?
What about junior tournament? No go then, right?
Those are individuals. That's just one kid going one place. But again, it's the same thing. I don't know why. This is why they got to clarify things. They're not good at. They should just say no competitive. I don't know. I don't know what they can say that's going to make it more clear, because there's too many different variables for sports. It's not like you have team hockey and then individual hockey.
Right. I think we need to get an official word from
USTA.
USTA.
Well, it's not USTA. You need to get official word from the state, and they're going to tell us later today. But Susanna, what I would suggest too is that probably either you or even Christy, if Christy is basically in charge of all competitive tennis in Connecticut at this point, that she get on the phone and try to contact somebody from the state so she knows specifically what they can do. She would probably get a faster answer than anybody else. And again, coming from her, it would be more official. If I emailed Dave Lehman and he says to me, stop doing these things, apparently for a lot of people, that's not good enough. So, that's – Bill, that wasn't even a joke. That's the funny part. You're laughing and that wasn't a joke. But it's true. It's just, this is where we are, where people, look at the sourcing of things and go, wow, I don't believe that because it's in an email. People said that. You're laughing. People said, I don't believe that it's an email. Can you get me a real document that says it? So that's where we are. All right, guys, let's wrap it up. I'm recording this. I will send it to you guys. I appreciate your time. And if anybody gets word on anything for today, please share it with everybody in that large email chain that I sent, and then we can all kind of communicate throughout the day and decide how much we're drinking tonight. Other than that, have a great weekend. And if we don't talk, happy Thanksgiving, and we'll see you guys soon.
Stay healthy.
All right.
Thanks, Chris.
Thanks, Chris.
Bye, everybody.
Chris.
Thank you so much.
Thank you.
All right, take care, guys.
Thanks, Chris.